one CCP official, I think, in the discipline inspection department. So the
very, very important one that's coming in from China. I'd like to thank you for joining me. Let me now open this to my guests who are joining us on the broadcast. Mr. Rajeev Jayadevan, who's a chairperson, National Indian Medical Association, and also a member of the COVID Task Force, is with us. And also joining us is Dr. Rajeev Dasgupta, National AEFI Committee member. Thank you so much, gentlemen, for joining us. We just heard what Jennifer Zeng mentioned, the reports that are coming out of China. Mr. Jayadevan, what do you make of the situation? Because only as we speak, we are talking about one person who traveled from China, came into India, and also was tested and turned out to be COVID positive. If we do not curb the kind of flights that are coming out of China and that travel advisory is not made stricter, we'd have many such cases coming in.
Those are good questions, but let me first explain what is happening in China, the first part of your question. It's like a dam that was holding a very large amount of water and the floodgates have just opened. Now, if you evacuate the people from the villages downstream ahead of time, yes, we can prevent human casualties. But in COVID language, evacuation is equivalent to vaccination. That is, if you vaccinate all the people ahead of opening the dam or opening the floodgates, yes, you can minimize casualties. But unfortunately, that did not happen, especially in the low-lying areas. That is, the people who were elderly. There are about 1 crore people. That is 10 million people over the age of 80 who are profoundly vulnerable for lack of having taken the vaccine. So that's a tragedy that is waiting to happen. And in that context, many people, I've heard them say that Omicron is mild, it's a common cold. That is not true. Omicron is as severe or nearly as severe as the original variant. Agreed that it's about 67% less severe than Delta. The difference is if it spreads in a vaccinated population, yes, it is much less severe than the original strain. Now let's turn to China. Omicron, the same virus, is spreading in a relatively unvaccinated population. I'm talking about the older segment. Now, I think the stories that were shown here clearly correlate with what we could expect if that were to happen. That, I believe, is what is happening in China.
Yeah. So, Dr. Dasgupta, thank you so much, Mr. Jayadevan, for, beautifully breaking it down for our viewers. And that's exactly what we have been talking about for quite some time now, considering we're looking at a possible increase, unfortunately, in cases here back home. Another question that comes to fore is, should the government go ahead and wait for, let's say, the New Year celebrations to begin? Only then should the restrictions kick in? Or do we not need restrictions despite the kind of stories that are emerging from China?
Thank you. It depends what one understands as restrictions. If it is, for example, about incoming travel, air traffic or sea traffic, there is no scope or room at all for such restrictions, because that's pointless. A, because it wouldn't stop the infections, and B, a lot of infection has already spread from China all around the world, just as it happened.
No, but Dr. Dasgupta, why do you say that? I mean, I just mentioned about a case about a person who was traveling from China. He was tested. He turned out to be COVID positive. Now his sample has been sent for genome sequencing. Don't you think this entire process we can actually do away with if the flights are stopped? Or do you think it cannot be done now that we've learned to live with it?
No, there are at least three things. One, travel restrictions have not stopped import of COVID into any of the countries worldwide. We have about 3 years of experience of that. Second, India, of course, is an immunologically completely different population from China, which is a lot immunologically naive, as Dr. Jayadevan very lucidly explained. And third, there is always going to be cases detected who are coming in from China. The international travelers can and should certainly be screened, and they should be quarantined and treated, and most of them, I believe, would recover uneventfully.
Okay.
There is no room for restricting travel, certainly.
Okay. Mr. Jayadevan, do you agree? And do you think this random testing of passengers at the, let's say, the IGI airport or various other international airports in the country, do you think 2% of those passengers being tested, do you think that works?
Yes, I believe it will work. It's impossible to test all passengers because airports will be completely blocked, and you know that very well. So that's one. Second is, if you saw today's Hindu, Vinod Skaria and Bani Jolie have written about the incredibly low number of sequences that are available from China. In other words, for our viewers, I'll say this: there is something called the GISET database, which is globally accessible for any user. We can all access all the genomes that are uploaded onto the server. So if you want to see the genomes that are circulating in France, it's easy for anyone to do that. Now, the number of genomes, for some reason, that are uploaded from China are so low. It's only 30 sequences since October. That's almost close to zero for a country that size. So the point I'm making is we simply do not know enough about the genomic profile of the variants that are circulating there. We're assuming it is Omicron. We know the old story about assuming. You might get it wrong. So it's always a good thing to go the extra mile and screen passengers and send them directly for genomic sequencing. It is not the passengers themselves are not dangerous as travelers. As Dr. Dasgupta said, restricting air travel has never, ever proved.
So what about vaccination now? How does the precaution dose help, and how does one go ahead and encourage people to, despite having taken both the doses of the vaccine, they should actually go and take their precaution doses as well?
Yes, we must remember that India is about 10 months past the last major wave. Now, that's a long period of time. And we are facing holidays, we are facing travel, it's winter conditions, people are going to gather indoors. The schools are out. So this might be the perfect setting for another wave to happen. Nobody can predict when a wave will happen. But when the perfect settings for a storm happens, a storm will happen. So likewise, if we are anticipating a wave with most likely a more immune evasive variant or let's say hypothetically a brand new variant, the vulnerable individuals should go the extra mile and get themselves a precautionary dose.
Okay. So, Dr. Dasgupta, one final word. Would you still induce people to go ahead and ramp up testing, or do you think that will incur a lot of fear among people and they should just be treated as a common cold? Should we still be on that statement, or there should be more testing that needs to be done?
There ought to be more testing that needs to be done. As almost worldwide testing in India has sharply fallen. What has also reduced in India, what we often don't take into account, is that the number of vaccination centers have also drastically declined. So ramping up vaccination would also mean getting back to somewhere closer to the original number of centers. And finally, to facilitate all of these, both vaccination as well as testing, we really need to reinvent our crisis communication, because what the communication strategies were 3 years ago, even 1 year ago, is not really appropriate now.
All right. Dr. Dasgupta and Mr. Jayadevan, thank you so much for joining us for this very important chat. I'd like to thank you both for being a part of this conversation. And before I end this broadcast this evening, let's talk about the monstrous Arctic storm that has gripped most of the continental US over the Christmas holiday, and it has